Good afternoon, class. My name is Mitesh Raval, and this presentation is for the week four soap nose presentation. And my chosen case study that I have seen this patient at last week. It's a 65 years old female. Uh, ID number is KP, date of birth 5/9/1957. Chief complaint. She says my head hurts for last 2 days, and pain is not getting better. Uh, Last physical exam was on June 5th, 2022. No concern at that time. The history of present illness. The KP arrived to the clinic early that morning. Uh, she was complaining about having the worst headache, getting worse for last 2 days. She has on and off headache, but that wasn't bothering her. Her daily activity as well as her sleep. The KP did mention that lying down makes her headache. When she lie down and close her eyes, the headache get better. She hasn't tried anything over the counter or any home remedies to take care of the headache. um, and as asked for KP's pain score, she told that her headache is pain is around like 8 in scan of 10. And the past medical history, she's very healthy person and does not have any past medical history of any chronic illness or any chronic problem. She does not have any mental health related to any issue of surgeries or hospitalization. No major surgery or hospitalization in the past. She's been up to date with her immunization. Already took her COVID vaccines, a booster dose also, and took the flu vaccine last month. Last month too. Her last annual visit when she came on June 2022, all the labs, everything was looking normal. There was nothing what concerning. So there was no follow-up visit scheduled for that. She's not allergic to any kind of medication, food, or seasonal allergy. Her family history consists of so her parents passed away at natural cause without any chronic illness. Mom sometime had a headache but wasn't diagnosed with anything else. So she has one brother who lives in a different state and does not have any kind of chronic illness at the time. She does not smoke or drink and does not take any kind of other drugs. uh, Diet wise, she's following the vegan and more vegetarian diet. She avoid having eating meat, any meat product. She does exercise at the nearby swimming senior citizen swimming pool where she goes uh, Monday to Friday, like an hour, and on weekends she normally goes walk with her husband. uh, Her husband also pretty healthy and does not have any chronic illness or takes any prescription medication. Social history: KP worked as a teacher in the public school for almost 25 years, and they both retired and living a retired life. Does follow religion of Christianity and does go to nearby church every Sunday with her husband. Does not have any problem and sleeping. She does sleep at 8 to 9 hours a day, but since last 2 days she been complaining of not getting proper sleep due to her headache. She denies of any kind of any infection, any kind of uh, fever or any problem. The review system, as the KP does not have any fever, chills as mentioned, and does not have any shortness of breath. Does have little congestion, but she denies of having any allergy of any kind of seasonal stuff. Uh, Ear, nose, eye, everything looks normal without any problem. Cardiac wise, no chest pain, no palpitation or any kind of dysarrhythmia. Respiratory wise, it denies any kind of shortness of breath, wheezing, or chronic cough. Gastro, no abdomen pain, nausea, vomiting. Musculoskeletal system denies any kind of joint pain, swelling, or any chronic joint issue. Neuro-wise, does mention about sometimes he gets a headache for last and this headache lasts for almost 2 days, which is kind of concerning her. And she denies having any dizziness or any loss of consciousness, denies numbness, tinglies, just the headache, which brought her back to the clinic even after her annual exam. Psychwise does not have any mental illness or any kind of stress or depression. Objective, the vitals are stable. She's a little overweight. Her BMI is 30. Physical exam, generally she's well dressed, answered all the question, maintained good eye contact throughout the interview. ENT wise, as I mentioned, there is no any kind of normal drainage or eyes pearla. Bilateral canal looks clear. No wax or any abnormal finding. Tympanic membrane visible clear. No nasal polyps or any epistaxis. Respiratory on auscultation, bilateral lung sounds clear, abnormal, and there is no abnormal audible sound. Cardiac heart sound regular, sinus S1 S2 heard, no audible sound, no abnormal audible sound heard. uh, lymphatic system, there is no swelling or any palpable lymph node or splenomegaly, hepatomegaly noted at this examination. Neurowise, cranial node 2 and uh, 7 as 8 is intact, alert, oriented, time 4, able to keep body postures straight without any other supports. Assessment, after assessing and collecting all the history, KPs the three differential diagnoses that we came up with. One was migraine. Migraine as evidenced by the unilateral headache that she complained about, and sensitivity to loud noise and the lights. This check the sinus for any sinusitis. Palpable, there is no palpable pain on the frontal sinus, so that has been eliminated. Cluster headache, unilateral headache, congested sinus, and does have a sensitive to bright light, so could be possibility of that too. But the final diagnosis, as migraine headache, as patient did mention that she has on and off headache, but never had the severe pain, headache or bilateral side for last 2 days. The plan for can consult, can do the neuro image like such as CT, MRI, to rule out any sinus infection or any problem to the head, for structural issue or tumor. Treatment, therapeutic and symptomatic treatment advised at this time, and uh, uh, as for the check for the patient eyeglasses prescription, which already was normal, that's as patient mentioned. Advise the patient to avoid the bright light and the loud noise. Advise patient to keep leg of the keep all the information, log of the headache, when that happened, how long does it stay, does the patient having aura with the headache. Asking the patient to mention that, keep reporting all the stuff in a journal and bring it next time when the patient comes to see. Treatment, as a patient did ask for the medication, the doctor prescribed the sumatriptan 85 milligram and naproxen 500 milligram daily as needed for the pain. Follow up, at this can return to office in 3 weeks to evaluate for the progress and the starting of the new medication. But in case if the symptoms doesn't get resolved or get better, patient can call the office and come anytime as needed. So the whole interview and talking to KP, looks like she has a more migraine kind of attack and migraine headache, which can be uh, follow up in 3 weeks. If the patient has similar symptoms continue, we can continue her medication and treat her migraine. Thank you so much for listening.